Last week, we talked about the things you should know about using some contraceptive methods. We mentioned 4 contraceptive methods: intrauterine device, condom, combined oral contraceptive pills, emergency contraceptive pills in Depo. Today, we will talk about the things you should know before using these contraceptive methods: Depo Medroxyprogesterone Acetate, Jadelle implants, Implanon, Sayana press injection. Before we get into the topic, be sure to hit the subscribe button if you're new here, because we are uploading health and fitness tips weekly. And hit the bell icon so that you won't miss these helpful tips. Number 1. DMPA, Depo Medroxyprogesterone Acetate. It is injectable contraceptive which is injected intramuscularly either buttock or deltoid muscles 3 monthly by your doctor. Advantages: is effective and good in controlling pregnancy. It does not need to take daily dose of contraceptive. Injection is effective immediately if it is given between day 1 and day 7 of your menstrual cycle. Relieve premenstrual syndromes or painful periods. Can be used in breastfeeding mother. Can be used in women with difficulty in remembering to take pills. Can be used in women whose partner is recently done vasectomy till semen analysis shows no sperms in semen. Disadvantages and side effects. You must come back to your doctor every 12 weeks to get boosted dose. You should never be late more than 4 weeks for repeated injection of DMPA. The most obvious side effect is weight gain in most women. Headache. Irregular bleeding and no menstruation for a whole 3 months. Delay return of your conception after stopping the drug. Risk of osteoporosis, which means your bones are weakened, fragile, and easily breakable. So, you should return to your doctor if there is excessive weight gain, heavy bleeding, or headache in order to change another type of contraception. Number 2. Jadelle implants. It is 2 silicone tubes containing hormone called levonorgestrel 75 mg in each rod, inserted in inner side of the upper arm of non-dominant hand by skillful and experienced doctors. It may need local anesthesia on injection site. The rods are usually placed in V shape. It can be inserted within 7 days after onset of menstruation or immediately following abortion. Advantages: rapidly effective within 24 hours of inserting implants. Effective usually up to 5 years. Do not interfere with intercourse and breastfeeding. Conception returns immediately after stopping contraceptive. Reduce menstrual cramps, menstrual bleeding. Reduce the risk of ectopic pregnancy and breast disease. Protect against endometrial cancer. Disadvantages: it is expensive and not easily available. Does not protect against sexually transmitted diseases. Needs skillful and experienced doctors for insertion or removal of Jadelle implants. Not suitable for women with suspected breast cancer, liver diseases, and heart diseases. Not suitable for a woman who is taking anti-epileptic drugs, anti-TB drugs due to drug interaction which may reduce the efficacy of implants. Side effects: irregular menstrual bleeding, pain in implantation site, dizziness, headache, breast pain, weight gain, acne, UTI, urinary tract infection symptoms. Care must be taken after insertion of Jadelle implants. Avoid heavy lifting for 2 to 3 days of insertion of implants. Keep insertion site dry and clean for at least 3 days. Go for follow-up in 1 week, 1 month, then 5 years later. Consult with your doctor if there is pain and redness in insertion site, infection, and allergy. Number 3. Implanon. It is soft, flexible implant preloaded in a sterile, disposable applicator for insertion under the skin. Its insertion site is the same as Jadelle, but it only contains 1 rod. Implanon can be inserted by your doctor within 5 days of menstrual cycle or within 5 days after abortion. Its advantages: Disadvantages and side effects mostly the same as Jadelle implant. Number 4. Sayana injection. It is a small needle containing hormone which can be injected on your belly or upper thigh by yourself or by healthcare professional. Women need to inject Sayana every 3 months like Depo. The first injection should be in first 5 days of your menstrual cycle so that it will protect pregnancy immediately. Advantages. Its effectiveness lasts for 12 weeks. You don't need to remember to take pills daily. It can be injected by yourself and easy to use. Does not interfere with sex and breastfeeding. It's not affected by other medicines. Reduce heavy and painful periods. It also helps with premenstrual symptoms for some women. Disadvantages. It's a new contraceptive, so it's not easily available. It does not protect against sexually transmitted diseases. You may experience irregular periods and delay conception for up to 1 year after stopping it. Your periods may change and become irregular, heavier, shorter, lighter, or stop altogether, which can carry on for some months after you stop the injection. It's not suitable for women with suspected cancer in breast or genital organs, undiagnosed vaginal bleeding, liver and heart diseases, blood disorders. Side effects. Weight gain in mostly first year of use. Headache, depression, mood swings, irritability, nervousness. Acne. Decreased libido, breast pain, pain and redness at the injection site. Menstrual changes like spotting, irregular bleeding, and heavy bleeding. These are the things you should know before using these contraceptive methods. After reading this post and the previous one, I hope you can decide the one that is the best for you. Have you ever used contraceptive methods? You can share your experience in the comments. Thank you for watching the video until the end. If you want me to cover any other health-related topics, feel free to ask me in the comments below or directly through my email. Peace out.